I've been walking with my face turned to the sun.
If you don't stand, I'm gonna have you arrested.
You may do that.
Weight on my shoulders, a bullet in my gun.
Would you like to pick a new name?
Harrington.
I do what I can when I can, while I can for my people. And I fight with the strength that I got until I die. So I'm gonna stand up, take my people with me. Together we are going to a brand new home, far across the river. Can you hear freedom calling, calling me to answer? Gonna keep on keeping on. I can feel it in my bones. To prepare a place for you.
Good morning, everyone. I just would like to welcome you. It is Women's History Month, and I am just so glad to have all of you here. And I thought about what it would be like for us to have like speakers that related to women and our issues. And one of the things that I really thought about was a specific woman's program for women dealing with mental health issues. And in that vein, I thought about the hospital who has a program like that, which is Chicago Behavioral Health Hospital. And I invited Richard Green, who is a community liaison for that hospital, to come and speak with us about that program. So he's going to talk about that program, but he's also going to talk about other programs that are involved, the hospital is involved with. So to that end, I would just like to say, welcome, Richard. Step on up, my brother.
Thank you, Suzette. First and foremost, I just want to thank Suzette and Kimberly for allowing me to come on here today and to discuss some of the programs that we do have at CBH. First and foremost, CBH is a mental health hospital. We have approximately 146 beds. With that being said, we have multiple programs. We have our inpatient programs as well as our IOP program. Some of the programs that we do offer are our detox program. We have patients that come to the hospital looking to detox off of alcohol, heroin, Xanax, Valium, fentanyl, prescription drugs, Vicodin, Oxy, morphine, and Percocets. So we do offer that program as well. We have our TCU program. That's our transitional care program. Our TCU program is for those patients that have a high acuity, the psychosis. They may be a little bit lower functioning, as well as some high aggression. And then we have our women's program, which is what I wanted to really focus on today. Our CBH women's program, it provides a trauma-focused treatment for those women who may be experiencing depression, anxiety, self-harming behavior, suicidal thoughts, post-traumatic stress, and postpartum depression. We provide them with process-oriented groups that utilize evidence-based treatment models such as CBT, DBT, and Seeking Safety. We also provide psychoeducational groups that promote the practice of healthy coping and self-care. While in this program, our patients will receive individual therapy to address goals around their treatment planning and a safety plan for their discharge, as well as family therapy to address relationship issues and establish appropriate support for returning home. Once a young lady is admitted to this program, our discharge planning starts immediately. We have a multidisciplinary team that works with want our patients so that they can provide them with the best possible care that they can. We also provide them with expressive therapy that includes yoga, movement, art, and music. One of the things that we found out is that a lot of times when a young woman comes to our hospital, you know, they may go to our ICU unit or our TCU unit, but then they're able to transition to our women's program. It all depends. Our women's program is a little bit more laid back. And I think that we get a lot of great feedback because it is so laid back. We get young women who say it's likened to a family environment. So that's one of the great things about it. And as I said before, we also deal with co-occurring dependencies as well on the women's program. So if they having those mental health issues, challenges, and also if they're seeking some type of drug treatment, we can also accommodate them on the women's program as well. So that is our women's program in a nutshell. We do expect that, you know, what the women that come to the program, that they're actively involved and actively engaged in the treatment process. A lot of times what we may see is a woman may come to the program and in the beginning, they may not be as actively involved because they feel like they were brought to the hospital under false pretenses or whatever. But once they get up on that unit, you know what, things tend to open up for them. They begin to talk more freely about what it is that led to them being hospitalized, and for them, that becomes an opportunity for them to start the healing process for whatever reason that they're in the hospital. All right, so if there were anyone that knows of a young lady, and let me say this, our age range is from 18 to basically end of life for that program as well. So you may have a young adult, and also the geriatrics. So if they can, well, let me go back. If they are suitable for that program, then that's where we will put them. So, and they could request that program in intake as well. So are there any questions in regards to our women's program?
Well,
hello. Oh, I'm sorry.
Go ahead. No, go ahead.
Hi, this is Jackie Lawrence, Resource and Recruitment from DCFS. Mr. Richard, I just have one question. You have an excellent program. Do you have any Spanish-speaking staff to work with our Spanish-speaking young women?
Yes, we do. Our team, like I said, we have that multidisciplinary team, and we also have our Spanish-speaking staff too for that program.
All right, thank you.
You're welcome.
Thanks for that question. But you know what? Once we hear all the speakers, we're going to break into little groups. And then if you have more in-depth questions, then that'll be your opportunity to just ask those questions, or you could put stuff in the chat box. Okay. Anybody else? No? So once again, we have a couple more people that joined, and I just want to say thank you for joining us for Women's Health Month. And we have tried to get as much information to the community as possible. Women's History Month is very important to all of us regarding health and other advocacy and programs that are specifically needed for women in our community. So I just want to say thank you again for joining us. next up, we are going to have the women from Metropolitan Family Service, and that program is the Nurse Family Partnership Program. And we have Teresa Ramirez. Hello? Okay, we have Teresa Ramirez. We have Kelly Traverina, and we also have Olivia, who's also with them today. Is that correct, Olivia?
Yes.
Okay. So Kim, I don't know exactly how this part goes, but if you want to just get them in so that they can just start speaking. Okay. All right. So I just want to say thank you for Metropolitan Family Service and the program that they're running over there. And we have these three lovely women that are going to talk about the program.
Hi, good morning. I haven't tried to share my screen yet, but I was wondering if I am able to do that.
Kim?
Yeah, it says I'm disabled from being able to do it.
So
If you try again now.
Yeah. Let me try. Okay, perfect. Okay, can you see my screen?
yes, we can.
Okay, fantastic. Okay, sorry. I'm still trying to figure all of this out.
You and us both, Kelly. You and us both. It's okay. You're among friends. This is family here.
I've been dreading this because public speaking is not, obviously, it's not my strong suit. I'm a nurse.
Okay, but you know what, Kelly? It's okay because you know what? You just do you and we will just vibe with that. It's okay.
Thank you. So good morning. My name is Kelly Tavermina. I am the nurse supervisor for the Nurse Family Partnership Program at Metropolitan Family Services. So as you can see, our little flyer, Nurse Family Partnership, strong families start with a great nurse. So a little background on Nurse Family Partnership. It offers states and communities one of the most promising approaches developed for helping low-income, first-time families succeed. So it draws its strength from an extensive body of research. It was conducted over a 30-year period in several different states, several different towns, urban, rural, and then they formulated the program based off of the results from their research. So the research demonstrates that NFP makes significant and sustainable differences in the lives of vulnerable families. So the program is completely voluntary. It's a home visitation program designed for first-time moms. And I know some people, when they hear home visitation, they scoff or they're like, nope, we don't want anybody in our home, especially right now during this pandemic. So we do have some creative ways to work around that. If it happens to be high schoolers, we can meet them at their school on their study hall, their lunch break. The schools, a lot of the schools have been really willing to work with us, let us come in if we have to, or in the nurse's office. We can meet them at a McDonald's if we had to, at a library, any other safe space, because obviously there's a plethora of reasons where somebody may not necessarily want somebody coming into their home. So we can tailor the program to what our client needs and what home looks like for them. So the pregnant mom has to be 28 weeks or less. So they just have to enroll in our program before they hit that 29-week mark. So they can be all the way to 28 and 6, as long as we get them enrolled on that last day. And then they also have to be low income. So we see the clients from enrollment all the way through their pregnancy, postpartum, and then until their baby turns 2. So they basically get a free nurse for almost 3 years, depending on when they enroll in the program. The nurse home visitors will see clients for 64 planned visits, give or take though, because we know things change, get rearranged, people cancel, can't make visits, but that's kind of the goal. The maximum caseload for one nurse is 25 clients. And then our ultimate goal is to have a full team of 4 nurse home visitors with 25 clients each. So to be able to serve 100 clients in our program and in our communities. So how much is the service? I already said before, it's absolutely free. There's no cost to the clients. They do have to be 200% below the poverty level. And that's where Teresa Ramirez comes in. She's our family support worker. So she is the first point of contact that anybody who's interested in enrolling would have. They would reach out to her. She would do the income eligibility. And if they are eligible, then she would do the intake and then pass it on over to me and we would get it assigned to a nurse. This is just some of our service areas. So starting out, we had focused on just a handful of southern suburbs, and then we realized that we probably had to expand our services a little bit more to be able to reach more clients and reach out further into the community. So these are just a few of the suburbs that we serve, but our focus is mainly on the southern suburbs of Cook County. So anywhere from Oaklawn, Evergreen Park, down all the way south where Cook County ends. At this point, we basically will take anybody in Cook County with the exception of the city of Chicago. Unfortunately, because of our funder, we cannot service the city of Chicago. There's like a conflict of interest right now. So they cannot have a Chicago address. That's our only outlier for where they live. So how can you help? We need clients, we need referrals. We take all ages too. It doesn't have to be teenagers. I have some clients who are in their 30s. Haven't had anybody in their 40s yet, but we wouldn't turn anybody away as long as they met the income requirements. So if you know a first-time pregnant mom that's 28 weeks or less, that's 200% below poverty line, lives in our service area, just not Chicago, wants a home visiting service to promote a healthy pregnancy, help establish effective child development practices, and facilitate economic self-sufficiency, you can call. That is our main number on there. And I can put that in the chat as well. And then you can email Teresa Ramirez and she can get the process going if you had a referral. So we are doing enrollments in some visits via telehealth for the duration of the pandemic. And then vaccinated nurses can provide in-home visits right now. They do have clearance to do that if the client and the nurse feel comfortable doing so. So any questions? I know you said we're going to do breakout groups. So if you guys want to hold your call or feel free to jump in however you want to do it, or you can ask in the breakout groups, whichever is totally fine with me.
I just want to say, if Teresa or Olivia have anything to add? Thank you for that presentation. It was awesome, Kelly. But Teresa or Olivia, if you guys have anything to add? I see Olivia shaking her head there.
No, Kelly really like, did a great also job, but I'm just like the intake person, the family support worker. So I also work, I'm the social worker. So I also provide the resources for the patients as well. Like depending what they need, like rental assistance, or I'm the resource person too. So it's basically the nurses, we do the medical and also the social services as well, combined together.
I do have a video if we have a few more minutes. I don't know how time is looking for us.
Oh, no, you have a few more minutes. Yeah.
Okay,
yeah.
okay. I'm going to see if I can get it to work this time. Last time I had some issues, but let's see if I can figure that out. Can you guys hear it?
When I found out I was pregnant, it was the summer before 12th grade. I was so scared.
It was really difficult not having my mom, my dad. As an immigrant, I didn't know how things were working here.
I was at rock bottom and I found out I was pregnant. I want better for myself and better for my life and his life.
Prenatal and infant and toddler development may be the most opportune time to make lifelong effects on human development and health.
Nurse-family partnerships intervention offers a multi-generational effect. Strong moms raise strong children become strong parents.
With Nurse Family Partnership, we support families in meeting their health and wellness goals for their physical health, but also what it means to be a healthy family.
When a mom has confidence in herself and her abilities, she's going to translate that down to her child. It's going to allow her to work with her child throughout many years as they deal with other challenges that they're going to come up against. When you talk with our moms, most often they have challenges such as homelessness, addiction, they're socially isolated, and that's where Nurse Family Partnership comes in.
No solamente la palabra, sino en dos idiomas.
I feel like I'm the support for them, but they're learning themselves, and it's amazing how they learn that they have the power, that they're powerful.
Woo!
I was in a very bad spot when I found out I was pregnant. I was getting high. I was very nervous and scared. And then I finally sat down and thought, and I went to John Brooks Recovery Center and I got put on methadone.
It's very common when somebody's going through addiction to have some type of trauma, something that happened in their life that they are trying to cover their pain with their addiction. So I helped her with resources to start counseling.
Dawn helps me with everything, learning how to take care of his needs and take care of mine at the same time.
James is a very happy, alert baby. His development is right on track. Now he's already attempting to try to crawl. He's a gorgeous baby.
Dad. Katie has helped me with a lot, and I think she might be my biggest supporter, honestly.
With Vicky, I feel she replaced not having a family. She feels like family. She is family now.
She's always there. It's not just for the nurse part. She's there for everything.
I can't imagine having done all of this without having been in the program.
We see long-term effects of the intervention and outcomes that are of unquestionable public health and social importance.
Since 1996, we've reached over 269,000 families. If you can change a family, you know you can change a community.
We're at this point right now where we have the opportunity to really scale up based on 40 years of success. We're going to reach the scale that's going to make a real impact in this country.
I want to just be the best mother I can be. I know there's going to be challenges, but I'm okay and ready for that.
Okay, so that said everything a little bit better than I did.
No, all I can say is, wow, that was awesome. Thank you so much.
Yeah, thank you. Thank you for having us.
You know what? And the thing is, for me, just listening to the video, if you can change a family, you can change a community. So that is very important. And, you know, since Land 53 covers Calumet City, Harvey, Dalton, and Riverdale, and we also cover the townships of Bloom, Rich, Brenneman, and Thornton Township, that's a whole service area that's open to people and information is being spread about. So if you can change one family, absolutely, you can change the community. So thank you so much, ladies, for coming and bringing that wealth of information to our land this morning.
Thank you.
Does anybody have any questions about that awesome video? I see James over there looking very serious.
I'm just looking online to find out, you know, how I could best connect CETA to some of these services or service providers. So no, thank you for the information.
Very good, very good. Anybody else? Olivia, did you want to say anything before we move on to the next presenter?
Suzette, I wanted to ask a question.
Sure.
If you serve, I'm sorry, if you serve moms from 28 weeks on until the age of 2, what do you, first of all, where do you get your referral source? That's my number one question. And then my second question is, if a mom is past the age of 28 months, where do you send them? Do you have a place where you refer families, or after the child turns 2? Do you have a place?
So we haven't had anybody whose child has turned 2 yet because we're still in newer implementation. So that resource we'd be working on, but I know there are birth to 3 programs that if somebody needed a continuity of care, we absolutely would refer into those. Our referral sources right now is what we're working on. So right now, one of our biggest referral sources is Family Christian. We're trying to tap into the WIC offices. We had a meeting with them because historically WIC has been one of the biggest referral sources for NFP programs all over the country. And then we've been trying to get into local hospitals, but just tapping into those resources for referrals right now, especially during this pandemic. We literally got started like the week after, or the week the world shut down. Like we went to Denver the beginning of March for training, came home, and then it shut down. So we've had some uphill battles trying to get referral sources. And then if they're over 28 weeks, unfortunately, we wouldn't be able to take them, but they can enroll at any time before that. They don't have to be in that 28-week mark. So if they're 6 weeks pregnant, they find out and they want to enroll, they can. If they're past that 28 and 6-week mark, we could refer them. There's a program at Catholic Charities. I'm not sure if they have a cutoff though. Okay,
we refer them. We refer them to Catholic Charities if they don't qualify. We have a contact person there that we send them to.
Let me just ask Ms. Johnson why she was asking this question, and maybe she has some information about the ladies. And then also we do have a person from Catholic Charities on the Zoom today, but we'll go with you first, Ms. Johnson.
Okay. I was asking because I run a Birth to 3 program in Chicago Heights, and we serve the South Chicagoland area as well. So maybe we can connect and maybe do some referring back and forth.
This is
that would be fantastic.
And I just wanted to remind everyone that the speakers are going to get another 30 minutes in the breakout session. And this is exactly what we're hoping will happen, is that you guys will have the time to really make these connections. So this is really nice.
Yes.
Okay, so that's my cue to be quiet then, and we'll talk in the breakout session.
Okay, but Olivia, did you want to have something to say, darling? We don't want to, I see you like smiling over there.
Hi, thank you for having me today. I'll talk more about myself and how I'll add to the program in the breakout rooms, but I just wanted to thank you all for having this meeting. I'm super excited. I will be one of the nurse home visitors that would be working directly with the clients. So I'm really, really excited about this. So
all right, thank you. Thank you. All right, so we're going to move on to our next presenter, who is Kristen Hadley. And Kristen is, well, let me just give this information. March is National Cerebral Palsy Awareness Month. And the Cerebral Palsy Awareness Day is March the 25th. So we have someone on, Kristen Hadley, who has her own foundation, and she's going to give us some information about the programs and about this foundation. Thank you, Kristen. It's all you, girl. Go ahead on.
Thank you, Suzette.
You're welcome.
My name is Kristen Hadley. I'm the founder, CEO of Other Myself with CP and ADHD. I'm a disability advocate, and also I'm a member of Cope Lions Cyber Club. I'm an advocate for you. I'm in advance your leadership power, AYP. I'm also a member of Family to Family for Children Mental Health. Next slide. This is a slide that talk about the different ways.
Hello, what happened? Kristen?
I think Kristen is muted. Okay, now she's unmuted.
Okay, all right, you back?
Yeah.
All right, baby. Okay, go ahead on.
This is different ways to get CP. CP is under the umbrella team of disorder that affect a person with moving. CP is doing to the the measure to deliver brain before, during, or after birth. CP affect people in different ways. It can affect body movement, muscle control, muscle cholesterol, muscle tone, reflex, power, pulse, toss, and what is BALANCE? Hello?
Balance.
Balance. People who have CP also have visual learning, health, speech, EPILE,
Epilepsy.
epilepsy, and INT,
Intellectual.
intellectual impairments. Next slide. It is case by an enjoyment to deliver brain rate most happen before birth. There is no single case, but researchers can define several facts that many learn to the brain injury. I know this. Injury.
Yes. Good work.
Babies cannot diagnose as at high risk of CP at 3 months of age. Next slide. Cerebral palsy. 8,000 children get diagnosed every year with CP. In 4 in 10 children will have expressed EPILEPSY. Epilepsy.
Yes.
In 1 in 10 are on the autism spectrum. CP is significantly more conversation among Black children than white children and Hispanic children and white children will about include likely to have CP. Next slide. That's the end of my presentation. I hope I did good. I hope you all learned a lot from it. From it. Oh, by the way, on March 25th, it's Cerebral Palsy Day. And every year, my organization hosts a Go Green for cerebral palsy. And what we ask you to wear the color green, post it on social media with the hashtag Go Green 22. And I'm gonna be on live on Facebook Live, hopefully on YouTube on that day at 6 o'clock. That is on a Friday, and I hope to see you all there.
Oh my God, Kristen, you just did such a wonderful job. Absolutely wonderful. Thank you, thank you, thank you. And just to reiterate, on March the 25th, which is Cerebral Palsy Awareness Day at 5 p.m., then it's going to be Go Green, and it's going to be on a live Facebook. Is that right, Kristen?
Correct.
Okay. And I just also want to add that this foundation was created in 2006, and it was created by an advocacy group called RFTS, which is Reaching for the Stars. And it's just absolutely wonderful that Kristen was able to give us this information. And I see that there's a couple of hands there. It was Christina, but right now it's Tyler. You have a question?
Yes. Hey, this is Tila.
Tila.
I just want to say, Kristen, you are the baddest rock star I have run into in a long time, because you just did what people who we assume have no impairments cannot do, will not do, are too shy to do. Yes. I really appreciate your leadership, and I really appreciate you standing up as a self-advocate. I'm grateful that you asked for help when you needed it, because sometimes people are afraid to do that. You did a marvelous job. I'm so proud of you.
Thank you.
Yes, ma'am.
Christina, did you have a question? I saw your little hand raising there a little while ago.
No, same thing. Just wanted to congratulate on such a great presentation. I did learn a lot, and I think you're doing a tremendous job.
Right. Yeah.
Thank you.
Absolutely. So Kim, you want to step up, and we're going to, I guess, break into our groups.
Can I just say something to Christian? Christian,
yes.
Congratulations. And I think, did you just have a birthday?
It's today.
Happy birthday.
My birthday. Thank you.
Thank you, thank you, thank you, Kristen. Wonderful job, wonderful job. I'm so very proud of you. And thank you, Suzette, for bringing such a phenomenal group of speakers today. And so now I am going to have the honor of opening up the breakout sessions. Once the breakout sessions are open, you will be able to select the speaker that you would like to follow up with. The breakout rooms will be open for 30 minutes and they'll automatically close. So you'll get the 60-second countdown, and then we'll return back to our general session. We always like to give a couple of minutes to let people kind of talk about some of their high points and some aha moments that they got in the breakout sessions. And then we'll close with announcements from Kelsey. So the breakout sessions are now open and the countdown is now. Thank you, guys.